Ketone bodies are three different biochemicals that are produced as byproducts when fatty acids diminished for energy. Two of the three are used as a source of energy for the brain. Neurotransmitters, such as serotonin and dopamine, work by changing these membrane potentials in various ways. Neurotransmitters can open ion channels, allowing sodium to enter the cell and causing a wave of electrical impulse that travels along the neuron. This can be the matter in bipolar patients, especially with the neurotransmitters of serotonin and dopamine. The synapse region doesn't allow a message from one neuron to pass to a different neuron correctly, making one react to a situation in an inappropriate manner, sometimes with little inhibition. When someone is during a ketogenic state, the electrical impulses that pass from one neuron to a different are opened by the mediation of sodium. It allows extracellular calcium to pour into the cell, which ends up in the discharge of the neurotransmitters of serotonin and dopamine into the synapse region. Then, it will be released to the subsequent neuron to get an appropriate response, like excitement or inhibition, betting on matters. The ketogenic diet and macronutrients. The three macronutrients are protein, fat, and carbohydrates. Ketogenic diets restrict your carbohydrate intake to 20 grams or less per day. Each carbohydrate gram has 4 calories, each protein gram has 4 calories, and every fat gram has 9 calories. This leads to the overwhelming majority of your caloric intake coming from proteins and fat. Ketone bodies are made up of fat, which is employed by your brain for fuel rather than glucose from carbohydrates. The ketone bodies, acetostate and beta-hydroxybutyrate, are acidic. The protons will be pumped into neurons in exchange for sodium, acting somewhat like lithium, which could be a common drug prescribed for bipolar patients. The additional protons outside the cell help do things like reduce the excitability of the neurons and reduce the activity of the excitatory of the serotonin and dopamine neurotransmitters. Limitations of the ketogenic diet for bipolar patients. On the web, you'll be able to find several blog posts and articles by those who have used ketogenic diet plans to boost their bipolar symptoms. Unfortunately, there aren't any scientific studies that fully support the findings of employing a ketogenic diet for treating bipolar patients. A ketogenic diet, kind of like one used for epilepsy, was found to possess stabilizing and antidepressant effects, very similar to you'd find in bipolar patients. And Stanford grad school attempted a study employing a ketogenic diet protocol on bipolar patients. Unfortunately, thanks to the lack to draw in subjects, the trial was never started. But this proves that they felt a study was warranted. Another limitation is that the restriction of carbohydrates within the diet. If one is restricted to 20 or fewer grams of carbohydrates per day, then they need to choose vegetables' low glycemic index scale. The glycemic index could be a numerical scale wont to calculate how briskly particular food raises blood glucose. So, foods low on the GI must be incorporated like broccoli, spinach, and lettuce, which only contain 1 or 2 carbohydrates per cup. And every 1 complex carbohydrates must be avoided like grains, pastas, and breads. Only 1 slice of bread can have quite 20 grams of carbs. This could make staying on the diet a difficult task given the restrictive amount of carbohydrates allowed, which does limit food choices. Summary: while scientific evidence has lagged in showing empirical findings that a ketonic diet works well for bipolar patients, there has been enough evidence that it's gaining attention, like at the Stanford School of Medicine. And scientific evidence does show that it does similar things to the neurotransmitters within the brain, like lithium does, which could be a common bipolar patient medication. While further research is certainly warranted, several bipolar patients have already begun prescribing to the present diet and proclaiming that it does help with their symptoms. So, if you're a bipolar patient, utilizing a ketogenic diet may be worth trying to work out if it helps alleviate the symptoms of your disorder.